Welcome to ReGenMed101 podcast with Dr. Yu. Learn about all things medicine, health, and wellness. We hope you enjoy listening. Please show your support by subscribing and follow our podcast.
Welcome to ReGenMed101 podcast. This is the interview series. I have here a special guest today, Dr. KZ Lin. Welcome, Dr. KZ Lin.
Thank you, Dr. Yu, and thank you, ReGenMed101, for the interview and having me on your podcast.
No problem. Well, Dr. KZ Lin, I'd like to start the interview off with asking you to tell the audience about your medical background, mainly your internship, residency, and maybe even your medical school as well.
Yeah, not a problem. So I went to medical school at S2E5 University in Mesa, Arizona. And following that, I did my internal medicine preliminary internship at University of California, San Francisco. And I did my PGY 2-year at New York University for physical medicine rehab, and currently finishing up my physical medicine and rehab residency at University of California, Irvine.
Yeah, that's great. And just for the audience to know, Dr. KZ Lin and I, we were both colleagues. He was my junior when I was at NYU. Dr. KZ Lin is currently the chief resident at University of California, Irvine, Physical Medicine and Rehabilitation Department. Being a chief there, is it pretty tough? I bet it's very difficult managing all the residents and juggling clinical duties as well, right?
Yeah, as every chief in every program, there's a lot of administrative and troubleshooting involved. But for us, there's a unique challenge since we're transitioning the program drastically from a 12-month didactic schedule to an 18-month didactic schedule, and we're re-ramping a lot of our rotations around, so I think there's a lot of new challenges involved whenever there's new changes implemented in a residency program.
That's great, and I'm sure they are very happy to have you there. So, Dr. KZ Lin, what are your current ambitions? Are you currently applying for any kind of fellowships? What's your plan for the next year?
Thank you, Dr. Yu. So I am applying to a pain fellowship. My goal is to eventually get into a pain fellowship and be able to practice interventional pain going forward. But I also want to still keep my physical medicine and rehab skills alive. I still want to do a lot of musculoskeletal treatment, utilizing ultrasound as well as utilizing electrodiagnostic study for management and evaluation of my patient population.
That's great. Dr. KZ Lin, you obviously have a lot of education and a lot of training in physical medicine and rehab, PM&R. You are applying to pain fellowships this year. May I ask, why specifically pain?
That's a great question, Dr. Yu. So I worked in a pain clinic as one of my first jobs out of undergraduate education, actually in the Kaiser River City. And there I saw what pain medicine was able to provide for my patients. I saw not only the oral medication component, which I was used to just being a lay citizen, but the interventional aspect of it, which shows direct treatment for very specific pathology that was providing these pain relief for my patient. I was actually involved in the research arm of Kaiser Permanente, where we were assessing whether steroids are helpful versus interventional steroid injections. And that was the beginning of how I learned about pain. And the field of pain medicine has evolved drastically. The technology, the science behind medical interventional pain management has evolved in a way like never before. Everyone in their lifetime is going to experience pain at one point in their life or not. And pain is one of the most challenging things to treat. So for me, based on all these experiences I had with pain medicine and looking into the future of what pain medicine could be, I really want to be involved in such an exciting field where you are providing a service that is applicable to every single human in the entire world.
Wow, very noble of you. That's very ambitious. When you begin your training at pain fellowships, are there certain aspects in your training that you'd like to focus on? Are there certain procedures you like to look into a little bit more or even have more training in?
I believe for me, the number one thing I want to focus on in that training is fine-tuning my diagnostic skills. So I think a lot of the times, the trick with pain management is really getting that diagnosis correct to ensure you are providing the appropriate treatment. But beyond that, I really want to get more experiences with peripheral nerve stimulators and spinal cord stimulators. I think the science behind there is very innovative, and I think it is a great arena in pain that can reduce all the side effects associated with opioids and other medications.
That's great. And the pain applications are currently going on, so we definitely wish you the very best. Continue your good work. And for the audience to know, Dr. KZ Lin also helped us participate in the episode for plantar fasciitis. Please take a look at that. When it comes to future podcasts, we would love to have you back on. So Dr. KZ Lin, what do you think of ReGenMed 101? Do you like the concept? Do you believe that there is value added for us doing a podcast, especially for the general public?
So I believe a lot of the information that is readily available on ReGenMed 101 is scattered throughout the internet and different resources. So I believe that general public really are unclear about a lot of these conditions or have contradictory information. What ReGenMed 101 provides is a central hub with scientific backing from experts who are actually well knowledge in these specific fields. I think this creates a amazing encyclopedia for the general audience to have just one area that they can just go to anytime they have any concerns regarding some of these medication treatments and diagnosis.
Great. So, Dr. KZ Lin, you're currently in California. Obviously, it's very sunny out there, probably good weather. What are your hobbies? What keeps you stress-free, and what keeps you busy, and what do you do for fun?
Being in California, we are in close proximity to the beach. We often try to go to the beach maybe once a month. I wish I could go more. I like to play sports with the fellow residents and my friends here. We play basketball together after didactics. On the weekend, I would play a round of golf with my friends in the area. And at nighttime, we like to meet at each other's houses, play board games, and just hang out with each other in general.
That's very nice. So, Dr. KZ Lin, before we complete this podcast, is there one thing that makes you unique that you like to share with the audience? Do you have any hidden talents, or are you a leader of an organization that we need to know about?
Oh, great question, Dr. Yu. So I'm actually one of the delegates for the resident union. I represent the interests of the UC Irvine residents on a national level. With the other unionized organization, we go into negotiation meetings with the administration for the hospital. Some of the accomplishments we got was getting a housing stipend, getting funds for food during lunch for residents. We're consistently trying to find better ways to improve residents' wellness as well. The other flip side, I'm also one of the officers for the graduate medical education, where I actually work very closely with the administration in developing safety programs for residents and patients, creating and facilitating quality improvement projects. And beyond those roles, I'm also involved in the American Osteopathic Physical Medicine and Rehab and the leadership panel, helping to spread the word about physical medicine and rehab, specifically to the osteopathic population, and as well as providing resources for medical students and residents in their future goals as physiatrists.
That's actually very great. Sounds like you're very busy. So it definitely sounds like you're very well involved with a lot of the residents and a lot of the medical education. For the med students that are out there that are interested in physical medicine and rehab, are there any resources, or do you have any advice that you would like to tell them in regards to applying to physical medicine and rehab, or just physical medicine and rehab in general?
Yes, I definitely want to let all med students who are interested to really do their research and really realize that physical medicine and rehab has a lot of phases. There's an inpatient component, where there is actually a lot of complicated medical patients who require medical and surgical intervention. And everyone knows about the outpatient procedures. I want them to research the possible fellowship from pain to pediatric to traumatic brain injury to the unofficial unaccredited programs. So there's a lot of opportunities in physical medicine and rehab. Just know that not everything's going to be an outpatient MSK sports clinic all the time, and that there is some challenges in the specialty that you need to be aware of before you make your final decision to pursue it as a career.
Yeah, that's very, very helpful advice. Thank you very much.
So once again, thank you, Dr. Yu, for the interview and having the opportunity to share on ReGenMed 101 podcast.
Dr. KZ Lin is currently the Chief Resident at University of California, Irvine Physical Medicine and Rehab Department. He has many leadership positions, and he is currently working with me directly in the American Society of Interventional Pain Physicians Resident and Fellow section as a resident liaison. Dr. KZ Lin is also applying to pain fellowships this year. We wish him the very best. We would also like to remind the audience and podcast listeners that Dr. KZ Lin participated in one of our episodes called Plantar Fasciitis, Foot Pain. ReGenMed101 is very thankful for him to spend time with us today. Until the next episode.
If you enjoyed listening to our podcast, please visit our Instagram, Twitter, and Facebook. For more detailed information, please visit our website at ReGenMed101.com.